Ulcerative colitis UC and Crohn's disease CD are both forms of inflammatory bowel disease IBD, characterized by chronic inflammation of the gastrointestinal GI tract, but they differ in their location, pattern of inflammation, and potential complications. Both diseases result from an inappropriate immune response, have periods of exacerbation and remission, and share symptoms such as abdominal pain, diarrhea, weight loss, and fatigue. However, their pathophysiology, clinical manifestations, complications, and treatment approaches differ significantly, making it essential for a nursing student to understand their distinctions for exams and clinical practice. Ulcerative colitis is confined to the colon and rectum, with inflammation affecting only the mucosal and submucosal layers of the intestinal wall. The disease progresses in a continuous manner, always beginning in the rectum and extending proximally without skipping areas. Because UC primarily affects the mucosal lining, it often leads to superficial ulcerations and friability, resulting in bloody diarrhea, rectal bleeding, urgency, and tenesmus, a feeling of incomplete evacuation. In severe cases, complications such as toxic megacolon, perforation, and an increased risk of colorectal cancer can develop. Extraintestinal manifestations, including arthritis, uveitis, and primary sclerosing cholangitis, may also occur. In contrast, Crohn's disease can affect any part of the GI tract from the mouth to the anus, but most commonly involves the terminal ileum and proximal colon. Unlike UC, Crohn's disease has a skip lesion pattern, meaning that inflamed areas are interspersed with normal, healthy tissue. Inflammation in CD is transmural, extending through all layers of the intestinal wall, which increases the risk of complications such as fistulas, abnormal connections between organs, strictures narrowing due to fibrosis, and abscess formation. This transmural involvement also contributes to symptoms such as crampy right lower quadrant pain, non-bloody diarrhea, and malabsorption, particularly of vitamin B12 and fat-soluble vitamins if the ileum is involved. Perianal disease, including fissures and fistulas, is more common in Crohn's than in UC. Both diseases are diagnosed using a combination of clinical presentation. Laboratory tests elevated inflammatory markers such as C-reactive protein and erythrocyte sedimentation rate, stool studies, endoscopy, colonoscopy with biopsy, and imaging, CT or MRI enterography for Crohn's disease to assess for deep tissue involvement and complications. Colonoscopy findings in UC typically reveal continuous inflammation, loss of haustral folds, lead pipe appearance, and superficial ulceration, while Crohn's disease often shows cobblestone mucosa, skip lesions, and deep fissuring ulcers. Management of both conditions involves a combination of anti-inflammatory agents, 5-aminosalicylates such as mesalamine, which are more effective in UC, corticosteroids for acute flares, immunosuppressants azathioprine, methotrexate, and biologic agents, tumor necrosis factor inhibitors like infliximab and adalimumab. Patients with Crohn's disease often require more aggressive immunosuppressive therapy due to its deeper tissue involvement and tendency for complications. Surgical intervention is more common in Crohn's disease due to the risk of strictures and fistulas, whereas surgery in UC, such as total colectomy, is curative, since the disease is confined to the colon. From a nursing perspective, understanding these differences is essential for patient education, monitoring for complications, and managing symptoms. Nurses should assess for signs of worsening disease, ensure nutritional support, since malnutrition is more common in Crohn's, provide emotional support due to the chronic nature of both diseases, and educate patients on medication adherence and lifestyle modifications to prevent flare-ups. Because stress can exacerbate symptoms, nurses should also promote stress management strategies and dietary adjustments, such as avoiding trigger foods that worsen symptoms. In summary, while ulcerative colitis and Crohn's disease share similarities as chronic inflammatory bowel diseases, they differ in their location, depth of inflammation, complications, and management. UC is limited to the colon, involves continuous mucosal inflammation, and has a higher risk of toxic megacolon, whereas Crohn's disease affects any part of the GI tract, is transmural, and leads to complications like fistulas and strictures. Understanding these distinctions is crucial for a nursing student to excel in exams and provide optimal patient care,